Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Dr. Tara Kirk-Sell of the Johns Hopkins Center for Health Security. They discuss COVID-19 and sports, including the safety of specific sports, whether we should let our kids play, and the risks for fans. Let's listen.
Tara Kirk-Sell, thank you so much for joining me.
Thanks for having me. It's great to be here.
So we're going to talk today about sports and COVID. And I want a little fun fact here. You're actually were an Olympic silver medalist in swimming. Is that right?
Yep, that's true.
So you have some COVID knowledge and some real genuine sports knowledge here.
Yeah, COVID and sports is like my specialty area of only a few people.
Excellent. Excellent. So we have, a lot of questions about safety, right? And so I sort of like to start maybe with sort of the youngest among us. And like, for example, my son is a high school cross country runner and he's facing a canceled season. Feels to me like running is safe, but I'm curious your thoughts on that. And could he be running safely?
Well, so I hesitate to say anything is completely safe, right? Because we know that there are always risks, tail end risks, the rare events. And so, with anything, something could happen. But I think for the most part, younger people, especially the sport cross country is already a socially distanced kind of thing. It's outdoors and people are doing kind of things on their own. So I would say that that's, a lower risk activity, and that, he could probably be doing that. And also, there's so many other health benefits for being an active person.
Mm-hmm. And I want to talk about that. So sort of what are the safest sports for kids and possibly the least safe sports at this moment?
Yeah, so I thought about this and in the past and have gone through like the Olympic sports list and tried to think, okay, how would I rank everything? But in general, I think, I try to think through what's the venue, is it indoor, is it outdoor? What's the level of contact and how long of contact we're having and how many people we're having together? And so, I think, okay, things like cross country, things like swimming, tennis, those types of individual or very, there's not too much contact going on. These are sports that I think are generally lower risk. And then, you go up a level and you might say, okay, we have contact, we might have more contact, but, or more close proximity, but it's outside. So baseball, I might even put football in here because even when they have contact, they're not in contact for that long. But then more even riskier than that, I would say like things like wrestling, highest on the list, possibly basketball might be up there.
Mm-hmm. So this has really struck a lot of people, sort of the lack of sports that we've been having. And so I'm sort of curious in your mind, why do we care so much about sports as a society? And why is it so important for us to see some sports at least happening again?
Yeah, this is a tough question because you could think like, well, we don't need sports like we do food and water and air, right? Why do we actually need to do this? And, I think it's different for everyone. But, back to when I was a swimmer, sometimes you think, why does this even matter? Why am I even spending my time doing it? And I think that a lot of people really, we need to either watch or be part of something that people are striving for something larger and something that's hard to do. And that is really something exciting to see. And it is helpful in sort of taking us out of ourselves and bringing us together as a society. I think that that's important. But I also think that, that goes within the list of things that are critical for us and that are our priorities. If we think about youth sports and we think about activity, I think that's incredibly important because we have also an obesity epidemic at the same time. So trying to think through how to do things safely I think is important for us going forward. We're not going to have an immediate vaccine. We need to think through how we're going to do things in a sustainable way, the things that we really are important to us.
Yeah, it makes me think sort of what factors sort of beyond contact on the field should we be concerned about with regards to COVID?
So I think some of these things are how often we're having athletes in close proximity, how long that close proximity is, what is the ventilation system. These types of things are really important. But I also think that beyond just thinking about what's happening in the field, it's really important to include what's happening off the field. And so I think that while the sport itself might be fairly low risk, that party every Friday night is not low risk. And so I think that we need to think about, these are also social gatherings, and it's important for our teens and our kids and young people to get together. But I think that, we need to have a culture of safety. Coaches and teammates need to be part of that to say, well, we can get together to do our sport, which is really important. But that doesn't mean that we're all safe together and that, we can go and party, at so-and-so's house, every weekend or something. This is where I think we're having a lot of problems, these uncontrolled events that are happening in people's houses. That's, I think, more of a problem than actually what's happening on the field, although the two are connected because that's a, social network there.
Mm-hmm. And I guess also people in the stands, because this makes me think of college football, right? So some colleges have canceled their seasons, but some are still going to play football. I just spoke to the mayor of Tuscaloosa, Alabama, who told me that about 18,000 fans will be in the stands when they host their first home game next month. So even though the stadium holds 100,000 people, this still feels like a lot of people and a COVID risk. What do you think?
Right. Well, so 18,000 is a lot of people, and you worry about bringing that number of people together. Now, if you're in an outdoor stadium, you're seated 6 feet apart. Okay, the stands doesn't seem to me like the biggest risk, but to me, then the other things that are involved with a big event like that is the tailgating. Are we lining up close together to get into the bathrooms? Are people taking off their masks in close proximity to drink or to eat their food? Are we having house parties or gathering at a bar around these events? Those are the things that I worry about. Oh, also like buses and joint transportation. So it's not necessarily having people in those stands specifically, but all the other things that come around these events. And that's why I really think, these sporting, the colleges, the sports teams, like all the people who are actually doing these and trying to put these on, there's a critical component here that they also need to be a messenger for public health and highlight how important it is for people to stay safe, wear their masks, do these things that, help reduce transmission rates in the community, which makes it then more possible to be able to hold an event, do your sport, and those types of things. So it needs to be a partnership.
Mm-hmm. Mm-hmm. We each have a role to play. I mean, I think of all the screaming that goes on in the stands, and we know that, screaming can send the particles further and things like that.
Yeah. I mean, that's definitely a risk. Nothing is, like I said earlier, nothing is zero risk. So it is possible that all the yelling in the stands could cause, some sorts of transmission.
So which would you say maybe is safer then? Sort of youth sports or pro sports? Is there a difference?
It's really hard to say because there's so many different factors that go into this. Youth sports are, there's less safeguards. Younger people, especially kids under 10 are less likely to have serious disease and significant transmission, or at least less likely to get the disease. I think transmission might still be a little bit up in the air right now. But the other thing, though, when you think about pro sports, is that they have doctors on call. They're spending a lot of money to consult, to think through the best technologies and the best ways that they can prevent COVID from becoming on their team, because this is big money. Right. And so, I think that that's one advantage that they have over, recreational teams.
Mm-hmm. Well, you say that, and it's true that they have all these doctors on call, but then if you remember just the beginning of baseball season, they kept having to cancel games because people were getting sick. And so in baseball, you barely even have to talk to each other.
Right. Well, baseball, I think one of the biggest problems is that, they were taking some precautions, but they were totally forgetting about other issues. So like having a team meeting, or like getting the team together in an indoor space, that can be a problem. And I also think, for a while, I think there was a thought that you could do kind of a fake bubble and that would be like good enough. And so I think that, if you're going to do, you're going to do something other than what the NBA and NHL have done, then you need to really be testing frequently, and you have to have people take it seriously. Mm-hmm. Your players and your team need to take it seriously because, there are real consequences for if you get, an outbreak going on your teteam. Mm-hmm. And I think maybe people didn't take it seriously.
Yeah.
And I can't really say what was going on in people's heads, but, it has been better since people have started to say, oh, wait, it really matters that we comply with the rules, and those rules are put in place for a good reason.
Right. Well, and also we've seen with some of the baseball players and actually some other sports that people who have gotten sick have gotten really sick. I mean, they've gotten heart issues that may not go away.
Right. I mean, even, the fittest among us can have, those bad outcomes. And so I think that it's important to realize these types of things and provide these lessons to the public as well.
Mm-hmm. I couldn't help, but I was watching some of the Ravens game over the weekend, and, these guys are like breathing on top of each other. They're in the huddles. They're all close. I mean, that's key to this game. And it was, as a public health person, it was kind of making me crazy that they're going to get each other sick. I think it's sort of a new reality for all of us to try to balance.
Right. I think it is really tough. I do know that the Ravens players and staff are getting tested all the time. Mm-hmm. And so that, as testing opens up and it's more available to everyone, I think that's going to really help people be able to make the right choices and be out of circulation, basically, before they have the chance to spread it too far. But yeah, there are risks. There are risks that people are going to undertake when they do these types of activities. And I think that we need to sort of make a judgment on what risks are worth it to both us and society. And those judgments are different for each person. And so I think it's just something that people need to think through.
Mm-hmm. And I guess as a parent, you want to see sports being played to see, let your kids, get out of the house and run around and just be kids again because they've been locked up for so long. Right.
I mean, I have kids myself, and I'm always thinking through like, okay, what kind of are the risks and benefits that we're balancing here? And in some cases, I think it's hard for people to sort of realize, but we don't live a zero risk life. And so we have to decide what's worth it. In some cases, it may not be worth it to do, that one event where you think that you're going to have a lot of a chance of exposure. But if you think maybe there's an event that's more well planned and that people are working hard to keep things safe, then maybe, and it has a lot of benefits to you, then maybe it's something you do. I think at the end of the day, it's about balancing those risks and deciding what's appropriate.
Tara Kirksell, thank you so much for joining me.
Yep, thank you for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.